Alright, am I a little late to this? Yeah, but still. United Healthcare CEO kept a low public profile, then he was shot to death in New York. Brian Thompson led one of the biggest health insurers in the US, but was unknown to millions of people. His decisions but was unknown to millions of people his decisions affected. Alright. Then Wednesday's targeted fatal shooting of the United Healthcare CEO on a Midtown Manhattan sidewalk thrust the executive and his business into the national spotlight. Alright. Look at the little baby. Look at him. He wants to say hi. He wants to say hi. Okay. Yep. Thompson, who was 50, had worked at the Giant Healthcare Group Inc. for 20 years and ran the insurance arm since 2021 after running its Medicare and retirement business. This is a guy, by the way. As CEO, Thompson led a firm that provides health coverage to more than 49 million Americans, more than the population of Spain. United is one of the largest providers of Medicare Advantage plans, the privately run versions of the U.S. government's Medicare program for people age 65 and older. The company also sells an individual insurance and administrators health insurance coverage for thousands of employers in state and federally funded Medicaid programs. The business run by Thompson brought in 281 billion in revenue last year, making it the largest subsidiary of the Minnetonka, Minnesota-based United Health Group. His 10.2 million annual pay package, including salary, bonus, and stock option awards, made him one of the company's highest paid executives. Jesus Christ. Is this? Yeah. Alright. University of Iowa graduate began his career as certified public accountant at PwC and had little name recognition beyond the healthcare industry, even to investors who own its stock. The parent company's face belonged to CEO Andrew Whitty, a knighted British triathlete who testified before Congress. When Thompson did occasionally draw attention, it was because of his role in shaping the way Americans get healthcare. For example, I don't know which healthcare company this is, but they have started putting caps on anesthesia. That's the word. They started putting caps on anesthesia, which is something you need. If you're going into a surgery, you need that sleeping gas. You need that numbing thing. The numbing shot. And they put a time limit on this. At an investor meeting last year, he outlined his company's shift to value-based care, paying doctors and other caregivers to keep patients healthy rather than focusing on treating them once sick. Healthcare should be easier for people, Thomas said at the time. We are con- congiz- co- cognizant of the challenges, but navigate a future through value-based care unlocks a situation where the family doesn't have to make decisions on their own. Thompson also drew attention in 2021 when the insurer, like its competitors, was widely criticized for a plan to start denying payment for what it deemed non-critical visits to hospital and emergency rooms. Jesus Christ. This guy was, like all healthcare CEOs, a monster. And that's why no one cares. Like, I have seen so many people on the internet, like, actually praising the shooter. Nobody cares that the United Healthcare CEO is gone. People are happy. And there's good reason for that. 281 billion, right? Yeah, 281 billion in revenue. And people are dirt poor. Like, there are people here in the US who cannot afford groceries. And this company is raking in 281 billion. Patients are not medical experts and should not be expected to self-diagnose during what they believe is a medical emergency. The chief executive of the American Hospital Association wrote in an open letter addressed to Thompson, threatening parents with financial penalty for making the wrong decision could have a chilling effect on seeking emergency care. United Healthcare responded by delaying rollout of the charges, not stopping it, just delaying it. Thompson, who lived in Minneapolis, suburb, and was married. Where was I? And was the married father of two sons in high school, was set to speak at an investor meeting in Midtown New York hotel. He was on his own and about to enter the building when he was shot in the back by a marked assailant who fled on foot before pedaling an e-bike into Central Park a few blocks away. The New York Police Department said. Chief of Detectives Joseph Kenney said investigators were looking at Thompson's social media accounts and interviewing employees and family members. Didn't seem like he had any issues at all, Kenney said. He did not have a security detail. AP... Oh. Okay. That's it. That's all the article has to say about this. Literally, nobody cares. I'm sure there are a few people who care, but like the vast majority of people I've seen are making jokes at this, saying things like the nearest hospital was out of network, things like that. Alright. I'll like, comment, subscribe, ring the bell icon. I'll see y'all next time. Goodbye.